Hi friends, in this video of fluid therapy I will talk about ringer lactate solution. First is the disclaimer. This video is made for educational purpose only and information available on this channel does not provide diagnosis or advice regarding the treatment. So the information used here should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animals. Please seek the help of medical expert for the diagnosis, prevention, and treatment of the medical illnesses. There is no endorsement for any brand or a company. Coming to the ringer lactate solution, that is RL, each liter of the RL contains 130 milliequivalent of sodium, 4 milliequivalent of potassium, 109 milliequivalent of chloride, 3 milliequivalent of calcium, and the bicarbonate content is 28 milliequivalent. So 100 ml of RL will contain 320 mg sodium lactate, 600 mg of sodium chloride, and 40 mg of potassium chloride, and 27 mg of the calcium chloride. As ringer lactate expands the blood volume very quickly, so it is very helpful for treating the severe dehydration. It has a similar electrolyte constituent as of human blood, so it is safe to use in large amount without causing any electrolyte disturbances. It contains sodium lactate, which is converted to bicarbonate in the liver, so it is helpful in correcting the metabolic acidosis. It provides all the necessary electrolytes and the bicarbonate, and that's why it is very valuable fluid for many surgical situations. In short, we can say that RL is a very versatile IV fluid. It expands the blood volume quickly. It is electrolyte balanced, helps correct metabolic acidosis, provides essential electrolytes and the bicarbonate, and this makes it a great choice for treating dehydration, surgical patients, and other conditions where the electrolyte balance is crucial. Coming to the uses of ringer lactate solution, it is used to treat severe dehydration quickly with large volume infusion. It replaces the fluid in patients after surgery, burns, fracture, or peritoneal irrigations. It is very helpful in treating the diarrhea, especially in all patients, including the children, because it effectively treats dehydration and electrolyte imbalances. It corrects the metabolic acidosis in diabetic ketoacidosis patient by providing glucose-free water and potassium. It maintains normal fluid and electrolyte balances during and after surgery. So if we say in short, it is very helpful to treat severe dehydration. It replaces fluid in various medical situations. It treats diarrhea-induced dehydration and electrolyte imbalances, helpful in correcting metabolic acidosis in diabetic ketoacidosis, and it is used as a maintenance fluid as it maintains fluid and electrolyte balance during and after surgery. Various contraindications for the use of RL are liver disease, severe hypoxia, or a patient in shock, because it can lead to lactic acidosis. Patients with severe heart failure, it can worsen lactic acidosis in the heart tissues. It should not be used in Addison disease. Patients with severe metabolic acidosis, as these patients, the body may not be able to convert lactate to bicarbonate. So if we use RL in severe metabolic acidosis, the condition of the patient will worsen. If the patients have persistent or recurrent vomiting or on continuous nasogastric aspiration, we should avoid RL because it can worsen the metabolic alkalosis. It's used as simultaneously with the blood transfusion should be avoided because the calcium in the RL can interact with the anticoagulants, the blood products, causing the clotting. Certain medication like amphotericin, thiopentol, ampicillin, doxycycline should not be used with RL because calcium in the RL can reduce their effectiveness. In short, we can say that don't use ringer lactate in patients with liver disease or severe hypoxia or shock are patient in septic shock, patient with severe heart failure, Addison disease, patients of severe metabolic acidosis, patient who has recurrent vomiting or on nasogastric aspiration, patient receiving multiple blood transfusion, and patient on medication like amphotericin, thiopentol, ampicillin, doxycycline, because calcium in these drugs, calcium in oral can reduce the effectiveness of these drugs. This was all about RL. Uh, Important quote said by Louis Pasteur is that science knows no country because knowledge belongs to humanity and is the torch which illuminates the world. Thank you very much.